Autoimmune disease treatments. So, what are some of the medication that is widely available today for treating the autoimmune disease conditions? Hi, my name is Sam. In this video, I want to talk about all the medication that's available today, and many of the medications I actually have been used in the past and at the present times. As we know, the autoimmune disease is a condition where your overactive immune system is basically attacking your own tissues and destroying some of the conditions in your body. According to the MedlinePlus.gov website, that's a government website, they define over 80 different conditions, 80 known conditions that belongs to the autoimmune disease that can cause different type of your damage into different section of your body. Some other websites like Cleveland Clinics, they identify more than 100 different types of autoimmune diseases. So there's quite a lot. And what are these medications that can treat this particular condition? And not all the medication will treat every single autoimmune conditions. They're very specific. But particularly, I want to focus on basically ankylosing spondylitis and arthritis, things of that sort that affects the spines and the joints and the conditions that I have. Just a quick disclaimer. I'm not a doctor and I'm not in the medical field. Everything I talked about are basically medications that I've been using on myself, conditions that I have, and treatments that it's been used in the past and currently. So if you have any medical conditions, medical concerns, medical questions, please refer that to your doctors and pharmacists. Thank you. So if you look at these pictures, I basically just grabbed it off the internet. Um, Autoimmune disease can cause quite a bit of conditions, the brain, um, thyroids, the bloods can have issues. GI is a very big one. Some people have it on the feet, the nerves. I have some, and it definitely will affect your lung. I'll have some other videos on the lung and the guts part, but skin issues. I have a little bit of it, not too many. That one's on the very light side, which is good. What I want to focus on is basically this area. It's where the arthritis, the rheumatoid arthritis, ankylosing spondylitis, and throughout my times with all the pains and seeing doctors and the treatment and the medications, all that stuff. So basically, this is what I just mentioned: the arthritis, the rheumatoid, ankylosing spondylitis, scoliosis, Crohn's disease. I don't have or that, but it's a very common autoimmune condition. Also IBS, I do have that too. Um, the treatment basically for it is there is no cure for the autoimmune condition. The only way to really manage it is through um, medications, or it depends. I guess it depends on the condition of every individual. Some people have it on the very light side, which is good for you. And I don't wish anybody who have these conditions or getting into very major severe issues. It's a very bad condition. So hopefully just a couple of pills for you and get it's all done. In my case, I have a very overactive autoimmune system. So over times, it damages a lot of the body parts, particularly the joints, the spines, and the shoulders and hips and all that stuff. It's very very painful. It's so painful. You can't even get up. Or just three types of medications: the nonsteroid and the inflammatory drugs that can reduce your inflammation. Generally, that's the the first line of medication. So when I started hurting in my young age, I believe it was in my teens, and 13, 14 years old, I started having these major hip pains. I go to my doctor, took some x-rays, and doctor didn't really see anything. So there's really no damage at the time. So when condition starts, there's no damage yet. But I am having a lot of pain. I was limping. Um, yeah, so go to the doctor, and the first thing the doctor would give you are basically non-steroid anti-inflammatory drugs. And as the condition progresses, doctors will give you more different stuff, methotrexate and all the others, and then finally, biologics. So the list down here are actually a lot of the drugs that I have used before. And like I said, right in the beginning, doctors normally will treat you well, doctors treated me with these medications, and I'm sure many people has probably used it: ibuprofen, ipraxin, Mobex. I actually thought it actually works. um, I was having pretty good results, and then ipraxin was okay. Ibuprofen, not so much. Not for the particular condition, the severity that I have. I was under so much pain, it didn't really do so much. And Voltaren, I actually took those. Those are in the very early days, and those are in my teens. And these are considered the COX1 inhibitors. These medications are quite bad for the stomach. Most of the nonsteroidal anti-inflammatory drugs it has an issue with causing GI conditions. So um, if anybody's on it, I would suggest you take it with food. Make sure you do. I was young and naive. I didn't think so much about these, and I just take it on a lot of these in my empty stomach. And now I'm really paying for it. I have GERD and ulcer and all that other stuff. So I'll talk about those in other videos, but please do take it with food. There are better non-steroidal anti-inflammatory drugs. That's called the COX2. Celebrex. I've been on Celebrex for years. In between insurance, when I was switching jobs or out of a job, the insurance didn't kick in, so I was only able to afford Celebrex. And Celebrex actually did an okay job. If your pain is not on a very high level, your inflammation is not very high. So it's I would say it actually worked okay. And then Bextra I also tried too, and I also thought Bextra worked. Bextra was before even Celebrex. But Bextra is it's out of the circulation now. It's ready to pull from the market because I believe there is a heart condition that's associated with that. So I thought Mobex was also pulled from the market, but I saw some places I thought they still have it. So I was actually my thought was wrong. So Mobex seems to be still in the market. Methotrexate and this other one I can't pronounce it. Hard to pronounce it. Methotrexate I used before. It's a pill. I didn't never use the injection, but it's an addition to the other medication. It's not used by itself. I used it alongside with with the one that's up here. I believe was at the time I was taking Celebrex and methotrexate at the same time. Um, I don't really think I have really good result with that. That's just me. A lot of people probably on it have good result. Otherwise, they wouldn't use it as a treatment. Yeah, but methotrexate is actually quite a pretty strong medication. There's a lot of restriction on taking methotrexate. I forgot what that is, and it goes through the liver, so doctor has to monitor you from time to time to make sure that the liver is holding up, not building up hepatitis through drugs. So, and then steroids. Steroids, it's either prednisones or injection pills. I was getting those from my doctor, actually from my surgeon. Um, I had a I had a surgeon. He did both of my hip replacement in the 90s. That's when I was in my early 20s, and I follow up with him for years. I went to see him like every 2 months just to monitor the hips. I really didn't need to see him for that long, but I kept seeing him because he was giving me some great drugs. So he gives me a couple of shots in the spine. That's when I was having my spine fusion. It helped. It really helped for me. After the shot, I get one good week of painless spine. It really worked out for me. So I keep seeing him every couple months just to get that. And then the next batch of medications are biologics. Now, biologics is really the go-to medication for the autoimmune disease, not just for ankylosing spondylitis or rheumatoid arthritis and others. The biologics are made for a lot of the autoimmune conditions, that including the one that I don't have. So, and there's quite a few different one. Some of them is approved for AS and arthritis. Some of them is only approved for Crohn's disease or IBS or other conditions, psoriasis and all that others. So the biologics, what basically, I don't have a scientific description for you, but what it is it's an immunosuppressant. So it suppresses your immune system. And we know that the autoimmune diseases is the body's immune system is overactive. It starts killing your own tissues. So these medications, in a simple term, it suppresses your immune system, so it doesn't kill your own tissues. So that's basically the simple term for it. And for ankylosing spondylitis, rheumatoid arthritis, when it progresses really fast. It starts killing all of my joints. It fuses my spines, and it causes a great deal of pain. And in order to either stop it or slow it down, well, you can't stop it. It can only slow it down. And in my case, I believe my immune system is so overactive. The biologics can suppress it just down to enough to keep the pain away, but the progression is still going on. So, but not everybody's equal. Your immune system might not be so overactive, and by taking these medications, it might suppress your immune system to too low. And yes, suppressing your immune system too low is not good. So we are very prone to infections or bacteria and other diseases. So whenever you get sick or somebody who is sick, try to stay away from them. You don't want to get sick. You want to make sure you stay healthy. So Biologics, that's for the joint community. There's 6 of them that's approved by FDA currently. The first one was embryo. I tried that. I gave embryo a 2-month trial. I didn't have much success on it. I it might not be the case. It might actually works, but the issue is I think my spine was so far damaged. Um, the biologic is not made to reduce your pain. It's lower the immune system. So the tissue, so your own immune system stops killing the tissue. But what's already damaged cannot be reversed. So does that make sense? So my spine is already damaged before I start embryo. So it did suppress my immune system. It didn't progress as fast as before, but whatever the damage is already there, it's already been done. So it might not be the case that it didn't work. It could have been worked, but my doctor switched me from embryo to Remicade. Embryo is an injection. You do it on your own. I was doing it one injection every 2 weeks, or you can do 2 injections once a month. Remicade is an infusion. I have to go into the doctor's office to do that, and it's once a month, every 28 days to every 30 days. I just set up the schedule. Remicade worked like a charm. It really worked for me. I was on Remicade for about maybe 6 years, but even though while I'm on Remicade, I was still having the same issue. I was having more results with Remicade than embryo, but it's still at the same time I was still popping a lot of painkillers because the spine fusion is still happening, and I was still in a great deal of pain, but it was just a little less. Let's put it that way. So Remicade worked for me for about 6 years until I developed a reaction to it, and then I got off of that. Humira. So after I got off Remicade, my doctor tried Humira on me. I took 1 shot of Humira, and I think I blacked out. It could be a coincidence. I was having anxiety disorder at the time, so it could be a possibility that it could be my anxiety. But then again, I didn't want to take the chance of taking more Humira, so I called my doctor and got me off of that. The next one that's approved is Symphony. Symphony I have not tried. Symphony is a infusion. Humira is injection. Symphony is a infusion. Sorry, infusion. You do have to go into a facility to do that. And from there, from Humira, my doctor also referred to. I actually tried Orencia, which is down here. Orencia did not have any effect. It's also an infusion. I have to go into a facility where they actually provide the infusion. Orencia is not approved for AS. Actually, I don't know why I have it here. Actually, it's not approved for AS. It did not work for Ankylosing Spondylitis. I have no effect on that. I took it for 3 months, and there's no effect. My body was very stiff, and everything else. But it's good for juvenile, and I think that it's approved for some other stuff. The other one is Rituxan. Rituxan is I did not use that. Again, it's not for AS. I don't know why. It's for this one I believe is for Crohn's disease. Um, I did not try that one. Um, then the next on from there, I had some insurance issues, so I got myself back into Celebrex, and I was on Celebrex for a couple years until I got my insurance back, and from there, my doctor and my surgeon, both of them, has retired, so I had to find a new doctor at Cedars-Sinai. I went to Cedars-Sinai and I found a doctor named Weissman, Dr. Weissman. He's a great rheumatologist. And he started me on Simcia. Simcia works really well and better than I expected. Um, but, all of my doctors are actually pretty good. So when I see Dr. Weissman, he always tell me to, he says, Sam, always use the smallest dose that can sustain your condition. So technically, it's no different than Humira and Embryo. It's a two-shot monthly. That's the standard. It's actually 400 milligrams. But what I was doing is at that time, first when I saw him, I was actually injecting a quarter of it. I was only injecting 100 milligrams, just half of the shot, and that will actually last me for a good 2 months. It worked that well. I was having no pain, no stiffness for 2 months. Um, but just to get some medicine in the body, I was injecting 100 milligrams uh, once monthly, and the other half of the injection, which is going into waste. So I have, I feel a little surplus at home because I wasn't using the full dose. Yeah, was the doctor, like I said, his name is Weissman, and he certainly is very wise doctor, and he's willing to work with the patient, and he doesn't want to overdo it, but at the same time, he doesn't want to give you any less, because if you get less, you're not going to be able to sustain, your condition. You're going to have a lot of pain. So the other new one, this is the new one that's approved on 2016. This one I have not tried. I'm still on Cimzia. Currently, I'm still on it, and it's still been working out. But over times, I needed more and more. I am currently maybe about 6, 7 years into, almost 7 years into it, and I am using the full dosage. I'm taking the full 200 milligrams per syringe, uh, once every 2 weeks. So 400 every month. So yeah, you develop the body kind of develop a resistance to. There are some newer um, autoimmune suppressants, and the IL-17s inhibitors. These two are actually, I believe, as pills that you can actually take. I have not tried that. These are approved on 2015, 2016. So, from the time now and in the early 90s, there's a lot more therapeutic. So, um, don't lose hope. Hopefully, you know, one of these will work for you. So work with your doctor. The main thing is to, you know, find a doctor that is willing to work for you, a good rheumatologist that's willing to work for you. And there's two other ones, the JAK inhibitors. Um, I have not used those yet, but again, over times the medications will develop, the body will develop resistance. So there's no saying that probably one day I will need to get one onto one of these, and this is probably the most recent one, approved in 2019, and it is good for AS and rheumatoid, psoriasis, and many others. So the best treatment is really the biologics for it. It really just suppresses your immune system so it doesn't fight your own body. So hopefully, if you need to, really get working with your doctors, and you know your body best. And if you are in pain, you think you are having the conditions, your doctors will check you out, make sure that uh, get you the correct diagnosis, and then hopefully they can get you on one of these. The sooner the better. The sooner you get on, and I do believe the sooner you get on these, the less damage it's going to cause. And these conditions, I can tell you, uh, they come very fast, and the pain is just tremendously bad. It's horrible. It hurts like hell. So I didn't like I said, I started hurting at 13, but they they don't know what it is. They can't put me on these biologics, and if they did, I can probably save my hips and my shoulders. Um, Yeah, but there's no saying. So you definitely have to find a good doctor, a rheumatologist that knows the condition, and they are willing to work with you and get you the right medications. Um, Now, I talked about how the biologic actually suppresses your immune system, right? And it slows down the progression, but it doesn't stop it. And I did mention it really didn't for me. It does not stop my progression, and over the time I still end up with a full fusion of my spine from the lower part all the way up to my neck here. So there's a little dilemma that I was just thinking to myself, if I am on these biologics and it suppresses my immune system and it slows down the progression. Now, slows it down doesn't mean stopping it. It doesn't cure my conditions. Isn't that really just kind of extending my pain? So it's just slowing down the progression, slowing down the infusion, just stretching the pain to a much longer time. But over I don't remember how many years, but still over a certain amount of years, my fusion is completely fused. But I do believe if I am not on these medications, then there could be a much greater damage in my body, not only in the spine, but it also affected other part of the body like the my GIs and the skin. And there's more than one. Usually, there's more than one autoimmune conditions. So I talked about this, and then, if I started early in my teens, it's possible that I might be able to save my hips and shoulders. But there's no saying that it would or would not. It's too late now. It's been so many years, and I have my hips replaced. This is the part of where I was, talking about if I'm not on it, I could have a much more damage in the body. And yeah, I believe it's a good thing to be on it, and at least finally, I was on it in the early 20s, but still, I have so much damage on my hip that I have to get it replaced. So it's just no other options. I was not able to walk. So um, yeah, get some treatments as soon as you can. Like I said, work with a good doctor. The main thing is to get the right treatment. Um, the last video I talked about the HLA-B27 markers. A lot of doctors are kind of reluctant to start people on medications if they don't have a positive test on that. And it's not all people who are tested positive only to have AS. Some people who are negative, they still have that same amount of damage. So I said, you know your body best. Talk to your doctor. Make sure the doctor is willing to work for you. If they don't, move on to the next one because you really need it. Hopefully, you can get treatments and have less damage than what I have. How many people has gone through, what I have gone through? Are you guys just starting with the medication, starting with the biologics? Are you guys who, just like me, who has gone through so much, pain, so many years, these with this particular horrible disease? Um, Leave me a message. Share some of your information. Share some of your journeys. I'd love to hear from you and see how you are dealing with it. Um, we can always share informations, and the more knowledge, the better for everybody. So I'm hoping to learn from you guys as well. I still have the condition in me, and see what you guys do and that kind of works out for you. Anyway, that's all for this particular video. I just want to cover some of the treatment that's out there that I have been used and actually that's available. There's a lot more than what I have in the days when I started my pains. So I'd love to hear from you as well. Hopefully, we can share information and we can learn from each other. And by the more knowledge, the better. So we can all help each other find those better days. So thank you for watching. Please give me a like if you like my video. You can subscribe. I have other videos coming up about other conditions that I also have, unfortunately. But hope you all have a good day. Stay pain free. Thank you. Bye bye.